It's just around the corner next Wednesday. It's our Take It to Heart screening day. Your heart health is something that we take very seriously.
Yeah, you know, it is the #1 killer of both men and women. Melanie has more on a new procedure that reduces some risk for strokes, Mel.
This is interesting, guys, and leading up to Wednesday, our Take It to Heart Day, we have been trying to educate you about the dangers and also the opportunities to reduce your risk of dying of a heart attack or stroke. Here is an opportunity for heart patients who can't take blood thinners. Just days ago, Memorial Hospital started performing a procedure that reduces their risk drastically of having a stroke.
Nothing strenuous, you know.
Joseph Brozovic has atrial fibrillation, irregular heart rhythms or beats. Some people tolerate it better than others, but as you age, everyone with the condition is more at risk for stroke.
There's better ways to go than a stroke. That when you have a stroke, you're incapacitated, and I don't want that as part of my life.
Patients usually take blood thinners to reduce the risk of blood clots that could travel through the body and stop blood flow to your brain. But some patients can't take blood thinners. Joseph is one of them.
We really worry about them because we have, unfortunately, end up leaving them with this risk of stroke without being able to protect them with the blood thinners, which is the normal option for the majority of people.
Dr. Vora is with Memorial Hospital. It's the first hospital in our area offering a new procedure using the Watchman device.
To implant a small little device inside the left atrial appendage, which is where we believe the majority of stroke related to atrial fibrillation originates from. And what that allows us to do is implant the device into the appendage.
It takes the risk of getting a stroke down from 8 to 10% to 1.5%, which is the same as if the patient was on blood thinners. Dr. Vora says the appendage has no other function, so the patient won't feel the difference. And once the device is in, it stays there for lifelong protection.
Then we check to make sure that there are no leaks, to make sure that the device is not going to move. And if everything looks good, we release the device and take everything out. People spend one night in the hospital. Everything go okay?
Joseph was ready to leave the hospital the very next day. The Watchman device won't treat the AFib, but it does put his mind at ease about deadly complications.
It's not that it won't happen, but the risk is a lot lower.
And for some perspective here, AFib is the most common heart arrhythmia in the world. And as the population ages, one of the #1 risk factors that drives someone's risk up for a stroke is age. It goes up at 65 and it goes up again at 75. If you want more information on this procedure, contact the Heart Center at Memorial Hospital. Also, remember, our Take It to Heart Day, it is next Wednesday, March the 23rd at the Jacksonville Fairgrounds. We kick off at 7 in the morning. It goes till 2 p.m. We'll have free heart health screenings, nutritionists to talk with, doctors to talk with, pharmacists. We'll have giveaways, chair yoga, a farmer's market. And when all is said and done, Bruce and Jen, you will take home a free T-shirt. Back to you.
Love it. Can't tell everybody enough and remind them enough about it. It's such a fantastic service. Thanks, Mel.